Hello, everyone. This is Kishore. I'm from TASC EC. Let me give you a brief agenda for this meeting so that you can plan through the end. So our Dr. Kalyan will be joining, and they will be talking about all our concerns and whatever the information they have that they want to share with us. And at the end of this session, there will be a Q&A prepared to ask crispy and more useful questions. Definitely, they will be answering all the questions that you have. So while asking questions, probably you can either send in a chat. Someone will pick up your question, and Doctor will be answering that. If not, it will be unmuted at the end of the session, so you can ask your question directly using your voice.
Thank you, first of all, for all of you for taking time to join with us today. And my name is Amarendra Reddy, and I'm the TASC EC member. And with the things that developed over the past few weeks, the talk of the town, it's not just talk of the town, it's talk of the world is the coronavirus. And as a community-based organization, we thought we'll have some expert in the field to educate us on what is our role in controlling, or at least to contribute in controlling the spread of the disease. And I'm glad to inform you that we have Dr. Kalyan from North Carolina with us. He's an expert in internal medicine, especially in viral-based diseases based in North Carolina. And he will be educating us on coronavirus, right from what the virus is and how the origin, the spread, the prevention. So with that, I request Dr. Kalyan Garu to take over and start the session. Thank you.
So I'll start with the basics. So COVID-19, which is, as Amar Garu put it, it's the talk of the world right now, stands for Coronavirus Disease 2019. And the virus that causes COVID-19 is actually Severe Acute Respiratory Syndrome Coronavirus 2, or SARS-CoV-2. So that's what you probably hear, either COVID-19 or SARS-CoV-2. COVID-19 is the disease, and the virus that causes the disease is Severe Acute Respiratory Syndrome Coronavirus 2, okay, SARS-CoV-2. So basically the disease, it's spread mainly via respiratory droplets. When one person either coughs, sneezes, or talks, you get the droplets that come out from the infected person, and they infect others when you inhale them or when they come into either close to your lips, your nose. Infection can also occur when a person touches an infected surface and then touches his eyes or her eyes, or his or her eyes, nose, or mouth. And that's why it's so important. So whenever you're on the outside, you touch something, you make sure you don't touch your face, you wash your hands thoroughly. Transmission is, the virus can remain viable for at least 3 hours from studies so far. So on any given surface, if the virus is on a surface, on a table, on a desk, on some book, whatever, if an infected person touches anything, the virus can remain viable for at least 3 hours. They all talk about, okay, it's very hot in India, maybe we'll get through this. No, it's heat, it's heat resistant. So whatever be it, it is viable for at least 3 hours on any surface, So that's why you have to be very careful. Since the transmission is more through respiratory droplets, whenever you cough, sneeze, make sure you cover your mouth with a hand, with a coat. Don't just cough into the open air. You're gonna likely infect other people. And hand washing is so important. That's why you cannot touch your face, because chances are that it'll just be close to your nose or your mouth. And once a person is infected, the clinical features can vary just from fever, which is seen in almost 99% of the infected people. 70% have reported fatigue or tiredness. 59% people have reported dry cough. 40% have reported loss of appetite. 35% of people have reported body aches. 31% have reported shortness of breath. And the cough is usually dry, but 27% of the people have had sputum or phlegm with the cough. So the variation in illness can be very mild. Some people might not even have any symptoms. They might be infected, but they basically have no symptoms, no fevers, no shortness of breath, no cough, not even sore throat. And this has been reported in 81% of the people. So then we go to severe disease. These are people who have infection, they have shortness of breath, they're very, very short of breath, and these people might need hospitalization, oxygen supplementation. So that is from mild to severe. Then we go to critical disease, when people actually have respiratory failure, they are in septic shock, they are in multi-organ failure. So this has only been reported in 5%. And this is usually people who are more than 65 and have other medical problems like high blood pressure, diabetes, heart disease, or if they have any cancer, if there are any chemotherapy, or if they are immunocompromised, their immunity is not well because they have other diseases and they are taking medications which can suppress the immunity. So that so people have seen critical disease in mostly this population. So the overall case fatality rate has only been 2.3%, meaning only 2 people, two or maybe 3 people of the 100 infected people have died so far. And as I said, these are usually as I said, elderly people and people who have other comorbid diseases, like as I said, high blood pressure, diabetes. Their immunity is not well because they have been taking immunosuppressants. People who have had transplants, kidney transplants, or any transplants, and even if they have something like rheumatoid arthritis and they are taking steroids for immunosuppression and who don't have immunity, this has been severe. When you go to when you have these symptoms, when you think you have come into contact with an infected person and you have these symptoms like cough, shortness of breath, it is essential for you to go get tested. The test for this is SARS-CoV-2 RNA, which is detected by reverse transcription polymerase chain reaction. You don't have to go into those details, but this testing is performed by the CDC or any CDC qualified lab. I think most of you probably have gotten WhatsApp communications or emails from your office. If you are in the corporate sector, you'll be notified of places where you can go to get tested based on your zip code. If you just put in your zip code, you will be notified of the nearest CDC qualified lab where you can go to get tested. Or you can just, if you think you have the symptoms, be it cough, be it shortness of breath, be it fever, and you have a suspicion that you might have come into contact with an infected person, then it's better off you go to any ER. They can test you and make sure you either have the infection or you don't have the infection. So once you get tested, and based on the symptoms, they might actually admit you to a couple of days in the hospital based on your symptoms, just to make sure you're stable. People who just have a cough, or maybe a mild fever, and if you are healthy, if you have no other comorbid conditions, there is a very high likelihood that you might be discharged. So once you get home, home care is essentially symptom management. So if you have a fever, you take Tylenol or acetaminophen, or in Indian medical terms, it's paracetamol for fever and body aches. Please do not use any NSAIDs or non-steroid anti-inflammatory drugs. So all the medications that come into this class are ibuprofen, Motrin, or Relief. Please don't use any of these medications, because as the name suggests, these are non-steroidal anti-inflammatory drugs, which means they suppress your immunity. So you don't take these medications. You only go with Tylenol, which is actually acetaminophen. Tylenol is the trade name. In India, it's paracetamol. So you make sure you take that for fever and body aches. You make sure you take a cough syrup for cough. Keep yourself well hydrated. So at home, the focus should be on prevention of transmission to others and monitoring for your own clinical deterioration. So if you think you're getting short of breath, that's the time you need to go to the ER immediately. You don't have to stay home. You need to go to the ER immediately. But if you think you're stable, if you don't have any symptoms, then your focus should be giving it to others. So everybody who's tested, or everybody who has symptoms, and not even if you're not tested, if you have symptoms, you should wear a mask when you are in the same room as other people. Make sure you're cleaning up well after yourself, whether you're in the kitchen, whether you are in the bathroom. Make sure you clean up well with Lysol wipes thoroughly. Make sure you wash your hands thoroughly. And even when you're present in the healthcare settings, and if you think you have symptoms, please try to wear a mask. And as I said, the goal is to not spread this infection to others. Disinfection of frequently touched surface is very important, since, as I said, the virus is viable for almost 3 hours once it's on a surface. No matter how hot, no matter how cold it is, but it is viable for 3 hours. So once you get tested, the home isolation, this is one of the important things. You can discontinue home isolation when your fever completely resolves without the use of acetaminophen. I mean, if you have been fever-free without the use of acetaminophen or Tylenol or paracetamol, then you can discontinue home isolation. If you have any respiratory symptoms like cough or shortness of breath, you have to have improvement of that too before you discontinue your home isolation. This is for the people who have tested positive but who are otherwise stable and who are at home. You can, as I said, you can discontinue the home isolation when your fever completely resolves and you didn't have to use acetaminophen or Tylenol or paracetamol. If you had any breathing problems like cough or any shortness of breath, you have to have complete improvement. Only then you can discontinue home isolation. For people who've had who do not have access to the test, but you think you've been exposed, or you think you have the symptoms, but you don't have easy access to the test or access to the test soon, then you have to isolate yourself first. Home isolation should be on for at least 7 days since the first symptoms appeared, and at least 3 days have passed since you have not had any fever, cough, or shortness of breath. I repeat again, this is for people who have not had a test or who don't have access to the test quickly. You can discontinue home isolation at least 7 days after you passed since the first symptoms appeared, and at least 3 days since you have completely recovered from symptoms like fever, cough, or shortness of breath. So as I said, and then coming to preventing exposure. So these are the things you need to do to prevent yourself from any exposure. You do diligent hand washing. If you are using a hand sanitizer, it should have at least 60% alcohol. And I think we've had multiple videos where they have showed exactly how you wash your hands, how thoroughly you wash your hands, how you do it in a proper way. You wash it multiple times. You make sure your fingernails are covered, each finger individually. You make sure you're covering your cough or sneeze. Avoid touching your face, particularly your ears, particularly your eyes, nose, and mouth. And please avoid crowds and avoid close contact with symptomatic. Obviously, symptomatic patients are not expected to come out in the open. But even if there is a symptomatic family member, you should avoid close contact as far as possible. And cleaning any objects and surfaces that are frequently touched is very important. So unlike the flu, which is mainly spread through the respiratory droplets, this can stay on the surface for a longer time, and that's why people are both doing droplet precautions. That's why you wear the mask, and then the contact precautions too. So you keep yourself away from any person who has symptoms as much as possible. So that's why you do this. So is there any? Do you have any questions now? I can take some questions now.
So there's a chat window open. You can start putting your questions there. We'll look at the first question here from Ishwar Bachu. Please suggest what extra precautions an asthmatic person at age 35 has to take apart from suggested ones.
First thing is diligent hand washing. As I said, use the hand washer, use the soap, use sanitizer. But if you're using a sanitizer, you should have at least 60% of alcohol in the sanitizer. Please cover the cough or sneeze every time you cough or sneeze. Avoid touching the face, especially your eyes, nose, and mouth. Avoiding crowds and any close contact with any symptomatic patient. This is tough with family, but try it as much as possible. And cleaning the surfaces that are frequently touched is very important. So these are the only ones. We don't have any other special precautions that we need to take. If you take all these precautions, you should be fine, unless you are in a place or you have a journey that's unavoidable, or you have a colleague who was infected and you didn't know that he was infected and you already had contact with that guy. There's nothing we can do about that. But once you know, you at least have an idea that you've been exposed, you just have to monitor for any symptoms. If you think you've been exposed, if you have any symptoms, I would suggest that you go to any ER and get tested quickly. But as I said, apart from these measures, there are no other special measures.
Is there any higher risk for some type of blood group? Is there any like a one group or the other group? Like, is there any risk for a specific group of blood?
No, not at all. No, there is no risk for any specific blood group. I mean, as I said, the only risky people who have been identified so far are elderly people or people with diabetes, high blood pressure, any cancer, anybody who is on who's taking medications that can suppress immunity like steroids, but doesn't matter which blood group we are all equal when it comes to this disease.
How to differentiate a normal cold fever with COVID?
It's just a normal fever. It's very hard to do that because a fever can be very non-specific. You can get a fever just from the flu. You can get a fever from, you can just have a viral fever. You can have fever from multiple reasons, but the only way you think that this could be COVID-19 is if you think you had exposure to somebody who was infected, whether in the office, whether in a train, whether in a bus, whether in a mall. That's all. So it's almost impossible to say that just because you have fever, it's COVID-19, or it's not. So just with fever, it's almost impossible to say it is COVID-19 for sure. Yeah, when you have fever, the thing that you must think is, was there any chance of me being exposed? If there was, then I think you should get tested.
So 80% of the people are there without having any symptoms. Is that true?
Yes. Yes. Almost 81% of reported cases have had no symptoms at all. Yes, that's true.
So what are the medicines that we should not use to suppress the fever other than paracetamol? I think this is the main reason for current situation in Italy.
Yeah, so the paracetamol, you can use it. As I said, paracetamol is nothing but acetaminophen or Tylenol in the US. In India, it's called paracetamol. In the US, it's called Tylenol. The pharmacological name is acetaminophen. So that is the only medication you can use for fever in this particular situation. That is the only medication. So please don't use Aleve, Motrin, ibuprofen, or any of those medications, because those medications, as I said, suppress your immunity and your disease will get worse. So you're not supposed to use any of those medications. So if you have a fever and you think this is the one you have, then you use only Tylenol.
Right. The next question is interesting here. Can someone get a coronavirus from the mail or the packages, like a SARS, severe acute respiratory syndrome, that was identified in 2003?
No, this is, as I said, it can spread when it is on a surface. So the only way it can happen with the mail is if the mail person has it and he delivered a mail and you picked it up quickly, like within 3 hours of him. As I said, the virus is viable on any surface for at least 3 hours. So if the mail guy has it, that's the only way. But otherwise, this cannot be something that can be mailed. No, it's not possible.
So where can I find the nearest CDC approved clinic near to us? So is there any official?
So I just got a message today about that, and I'll forward that email to the COVID-19 session group today as soon as we're done with the meeting. And then I think as soon as you put in the zip code, you'll know exactly where to go for testing. You can forward it to all the members of TASC, and then it'll be helpful.
Okay, the next question. Are there any specific suggestions for older people?
The same suggestions, Andy. I mean, they're going to be the same suggestions. It's unfortunate that they are the ones who are getting affected the most, and the disease is severe in older people. But as I said, it's the same precautionary measures. Especially the older folks, I would say that they should be at home for the next few weeks. They shouldn't get out of home. They should avoid any exposure to anybody. Social distancing is actually more important for them than anybody else. So if you look at all the corporate companies here, they are actually doing a lot for senior citizens. They're actually opening the stores for senior citizens between 7 and 7:30 or 6 and 7:30, so the senior folks can come do their shopping and then leave, thereby decreasing the chance of their exposure to this disease. So I would suggest that if you have any elderly folk here or back in India, you ask them to just stay home as much as possible. Hygiene, hand hygiene is very important. Respiratory hygiene is very important. They should completely avoid any crowded spaces. I think they've already shut down a lot of malls, movie theaters in India, temples even. So I think they should avoid any place that might get crowded, even like temples, So that's about it. The same thing that we follow, they have to be stricter. And social distancing, they should do it on a priority basis. They should stop meeting, others and stop going out for the next few weeks.
Okay, the next question. How long this disease stays in the person who does not show any signs of fever, cough, and cold?
So the incubation period is 14 days. And I mean, the incubation period is when you first come into contact with an infected person and then you start showing symptoms. That's called incubation period. So it is usually 14 days for this COVID-19. The symptoms usually start on day 4 or day 5 after you've been exposed to an infected person. So the 14 days is what everybody is suggesting. So from the day you're exposed to 14 days, you should complete the whole clinical course from the start to the end of your symptoms. If you don't have any, that's it, you're done. After 14 days, it's very unlikely that you'll have anything. Anything that will happen in the first 14 days, more so on day 4 and day 5. And then the one more important thing is the viral RNA titer, or the viral RNA titer is very high in the initial stages of the disease. So a guy who might not be very symptomatic or very severe, he will transmit the disease most because the viral titers are so high in his body in the initial stages on day 4 or day 5. And later on, it just keeps going down. So that's what it is. So 14 days is what studies have shown so far.
And if someone traveled in flight and comes to our home, what precautions should we take?
So they should at least self-isolate themselves, and to be on the safer side. You never know whom you've been exposed to, no matter what flight it was, whether it was a domestic flight or an international flight. You should at least home isolate yourself. I mean, they are actually suggesting 14-day home isolation. So, I mean, if you don't have any symptoms, then you should be okay. But I think you should, in the interest of others in the family and at home, and not taking any chances, you should isolate yourself at home.
Does coronavirus spread through air? The latest news is by California governor is half of the California people could get sick. How true is it?
Yes, I mean, the infection is mainly spread when somebody coughs or sneezes, and the respiratory droplets are in the air. But you have to be within 6 feet of that infected person. It just won't happen at a distance. So you have to be in close proximity to an infected individual for you to get this disease through air or respiratory droplets in the air. But you have to be close. So that's it. So that's why the social distancing. That's why you keep distance from actually anybody. But I don't think that if I sneeze here and it'll be in the air, and then a little while later when somebody is just passing through that way, it won't happen that way.
Is there a way to know if I got COVID and got healed automatically?
No, and you will never know that because, as I said, 81% of people had very mild symptoms or no symptoms at all. They wouldn't have known. I mean, these people probably got tested because they were in an area, because remember all these tests, most of these people, most of the studies that we are looking at are all from China. About 80,000 people got infected in China, in the Wuhan province. So we are looking, so most of the studies are looking at those people from China. So these people, just because they were in China and then just because they were in Wuhan province, they probably got tested to be on the safe side, but never had any symptoms. So those are these 81% of the people. So you would never know until you get tested if you didn't have any symptoms. These people, as I said, just might have gotten tested because they were in Wuhan province in China. And you also have to remember that Wuhan is bigger than New York. It has 11 million people. So a lot of people got tested just because they were in Wuhan. And as I said, 81% had no symptoms or very mild symptoms. If the same thing happened in maybe if somebody in California, maybe they wouldn't even get tested because there's nothing happening with them and they're safe, stable, they're healthy. So you would not know. To answer your question, you would not know until you get tested if you have had symptoms.
Can pets get coronavirus? How effectively do you think CDC is acting in terms of controlling it?
Yeah, pets can get coronavirus too, and I personally haven't come across any regulations from CDC for the pets, unfortunately. So yeah, I mean, pets can get too, and I haven't heard of any pets actually getting sick through this virus. Because if you notice the initial spread of the virus in the Wuhan province or in the Wuhan province, they were actually, this disease was actually transmitted through animals to start with in the Hubei province in China. But there have not been any fatalities or any sick animals from this disease. I think it only infects and affects humans. So CDC, as far as I know, have not released any guidelines. They probably would suggest that we take the same measures, just keep even the pets as hygienic as possible. That's all.
The next question, let's say the mailman has a virus and I picked up the parcel and immediately washed my hands. Are we safe in this scenario?
Yeah, I mean, as long as you have washed your hands thoroughly and you haven't touched your face, eyes, nose, and mouth, you should be okay. As I said, if you touch, if the envelope or anything was infected and you washed your face, you washed your hands immediately without touching anything else, yes. But I'm also telling you guys, if you have symptoms that are severe, forget about the CDC lab. Just go to any ER, especially shortness of breath. People have gotten from mild shortness of breath to severe respiratory distress very quickly. So if you have anything of that sort, don't wait. Please just go to the ER and let the physicians handle it. Because people, as I said, once they've gotten shortness of breath, that has gotten very severe very quickly, like within 24 hours. People have gone from mild shortness of breath to being intubated within 24 hours. So if you think you have shortness of breath and it's getting worse, don't wait to go to a CDC lab, just go to the ER.
Yeah, not sure what the question is. Probably the question is like, is the domestic flight any different from the international flight?
No. I mean, they're not different. As far as the spread of infection is concerned, if there is one infected person in the flight, your risks are as good as you flying international. So it doesn't mean the domestic flights are safe. The same risk, you will have the same risk.
What precautions can we take while purchasing groceries?
So I would suggest that you all wear at least a mask, a simple mask, to make sure you're avoiding any droplet or airborne. And then as soon as you get back home, I would suggest that you wash your hands thoroughly. You wipe everything clean with Lysol wipes and all that stuff. So basically, it's the same hygiene, even when you're in a mall or in your grocery store. Just maintain your distance from others. Do not get too close to them. If somebody has a cough or sneeze, make sure you cover yourself with your hand. That's about it. Just being very careful. That's all.
If we have a fever and not sure whether you are infected or not, do you need to wait until other symptoms show up like cough and shortness of breath?
No. As I said, even when you look at the symptoms, right, 99% of people had fever, only fever. Okay, they didn't have any other symptoms. So almost everybody with COVID-19 will have a fever. Whether they have shortness of breath, dry cough, body aches, is another thing. But most of them, 99% will have a fever for sure. When you have a fever, what you have to think is, have I been exposed? Was there any chance of me getting exposed to somebody who had this COVID-19? And you have to be 100% sure of that. If not, and if you are in doubt, I would suggest that you just go ahead and go get tested. If you are very sure that you haven't gone anywhere and there is no chance of any infection, and then we look at other sources. Maybe it's a urinary tract infection, maybe it's an infection elsewhere, maybe it's just a viral fever, maybe it's the flu. But either ways, I think it is important for anybody who think they've gotten exposed to go get tested.
We have a parcel in transit from India. It started in Hyderabad, and in transit, it went to Bangalore, Germany, London, and USA. What precautions do we take for this parcel, which is arriving tomorrow?
So I would suggest that if it is a parcel that's been well packed, I would suggest that you wipe the box with Lysol before you get into the home. I would suggest that you unpack the box and get the things out while the box is still outside, and get the stuff that's inside. But I would suggest that you keep the box outside the home and get the stuff inside. And then once you get in, make sure you wash yourself really well. You thoroughly wash your hands. Any surface that's come into contact with that box needs to be neatly cleaned up. So that's what I would suggest. If it's been through Europe, Europe is now looks like Italy has taken a massive hit. Spain is getting hit now. Germany and London have been okay so far, but why take a chance? I don't think it'll be infected, but just to be on the safe side, just to get the doubt off your mind, I would keep the box outside the house, unpack the box, and then get the stuff inside. And then once you come inside, just make sure you wash yourself well and clean up.
So for that matter, like anything that comes into our home, whether it is a mail or this one, should we follow the same precautions? Earlier, like you stated, it will stay only for 3 hours. So if it got infected in London, like it took more than 3 hours to come to USA. So do you still need to follow this?
Right. Yeah, I mean, as I said, just to be on the safe side, because it's been to so many areas, just to be on the safe side, they've stopped everything, everything from some countries. So just to be on the safe side. Okay, the mail, as I said, it is very unlikely to get infected from mail. But as I said, if you are so unlucky that your mailman is infected and then is delivering you, that is the only way. But I'm just giving you the worst case scenario, but it is very unlikely for you to get anything from mail. I'm going to reiterate that fact again. Very unlikely, but worst case scenario, there is a chance through the mailman. That's what.
Okay, next seems to be a $1 million question here. In your expert opinion, how long would this pandemic continue, and when do you think things go back to normal?
Yeah, it is. It is $1 million question. As I said, I wish I had an answer for that, but things are not looking good at this point in time. We've seen a surge in infections recently. So I would think, if they shut down everything and we flatten the curve, maybe, because China is already getting back. They started in late 2019, so we are in March now. So we are looking at least 8 weeks, at least 8 weeks. That's what everybody is predicting. So we'll see how that goes.
So basically, it looks like we are in the race between infection and prevention. More people interact
Yeah,
will be
exactly.
infecting more, and if completely
Yeah, exactly.
isolated,
That's
it will
what
be.
yeah, exactly. And that's why they shut down everything, right? I mean, corporate America is working from home these days, and they're trying to avoid anything, any big gatherings, any flights. And they've literally locked down a lot of counties. So hopefully the curve will flatten, the spread will stop, and we'll see how it goes. But at this point in time, we're looking at at least 8 weeks for everything to start getting normal.
8 weeks. Okay. So the next question, in general, a virus does not survive longer in sunny weather. Is this true with the coronavirus too? Do you anticipate the spread of this virus will come to halt once we hit summer?
No. So it doesn't. So the weather, unfortunately, has not got anything to do with COVID-19 at least. So the summer won't help unless we stop, we do the social distancing and all these preventive measures that CDC is recommending. Summer by itself, or the change in the weather, will not help.
So only medicine is like social isolation. That's only the prevention seems to be.
Yeah, for now, prevention is the key here. So prevention of spread is the key here. So, in North Carolina, there were only, I think, 2 cases to start with. And then some of the Biogen employees here had a conference. And when they came back, one day they had like 5 cases and so on. So it's all, human interaction. That's how it's just spreading rapidly.
Okay, the next question. Can you get a reattack by virus after you got it before and heal from it?
So in this case, as far as COVID-19 is concerned, as soon as you have any infection, whether it's virus or whether it's bacteria, more so for the viruses, once you have an infection, you develop antibodies and you develop immunity. So it's very unlikely that you will be infected again with the same virus. So it will take some time for your antibodies stay in the body for some time. So it's very unlikely for you to get hit with the same virus again quickly. With the flu, it is different because the virus keeps changing their structures, and they have different forms every year, and based on that, they develop the vaccines every year. So you have to get the vaccine every year. But with this one, the COVID-19 or any virus in general, it's very uncommon for the guy to get infected again because you're now immune to that disease. Once you have it, you develop antibodies against it. You have some immunity against that disease. So it's very unlikely, to answer your question.
Okay, the next one. The California governor said half of the Californians could get sick. How true is it? This is a...
It could be, I think they are being extremely careful, and they are actually thinking of the worst case scenario. But it's very important. It's almost impossible to say will get infected for sure. But I think they're just predicting and just being very careful to make sure that everybody is taking the extra precaution to contain the spread. But if it's in the community already, we don't know how many people have it. Because as I said, 81% of the people who've had it have had no symptoms, have had very mild disease. So it might be in a lot of people, but they might not know that they have it. So it's almost hard to say that is a wrong statement, but it's almost impossible to also say that's the right statement too.
Yeah, the next question seems to be a repetition, but still I would like to ask here, will we get reinfection? Will our body develop antibodies in the first occurrence, and will antibodies help in the second occurrence?
Yes, they will help you. And as I said, it's very unlikely for you to get hit again because you would have had immunity for that.
Will shortness of breath symptom be continuous or it would be intermittent?
Shortness of breath would be very mild in most people, but some people, as I said, when the disease is severe, they are getting very rapid deterioration in the status. So they are getting like shortness of breath from very mild shortness of breath to, as I said, rapid deterioration to a point where they are getting intubated. And then it gets better. So if you had just only mild shortness of breath, which might be continuous, which might be there for a couple of days, and then you'll get better. But if it is continuous, it's getting worse. As I said, you have to go to the hospital, obviously. But it's not continuous. I mean, as I said, in the 14-day period, you would get severe, you would get sick on day 4 or day 5. And the shortness of breath will be, if it is mild, it might be there for a couple of days, and then you'll get better. So intermittent shortness of breath is very unlikely, but it has happened in some cases. Yes.
Next question: does drinking hot water with lemon help killing virus?
Yeah, this was something somebody just told me too. But as I said, these are all home remedies. There is no study or any proven efficacy for these studies. These are all home remedies.
So if that works, lemon would be the medicine for this virus.
Yeah.
So how do we boost our immune system to COVID-19?
There is nothing you can do to boost your immunity, unfortunately. As I said, if you don't have any comorbid conditions like high blood pressure, diabetes mellitus, any heart disease, you're not taking any medications to suppress your immunity, and your health is in good condition, then you're good. On top of that, there is nothing you can do to boost your immunity.
Okay, the next question.
So that's what I would say.
Sorry.
Mm-hmm.
The next question, if there are any symptoms, is calling a MD Live virtual doctor or going to ER, which is better?
If you have the luxury of the virtual doctor, then I would say yes, go with it and have a consultation with the physician over the phone or over the video. That would be, and you just go over your symptoms with him, and then based on what he says, if he thinks that you should go get tested, go get tested, or go to the ER if you have any symptoms, then go that way. But if you have the luxury of just calling the physician or video chatting with the physician, then I would go that way.
How are symptoms in kids? Is it like common cold or flu-like?
Fortunately, so far, the kids have been doing very well with this COVID-19. They have been very mildly asymptomatic. So they've had very mild symptoms so far. Kids luckily have done very well with COVID-19 so far. They haven't had any fatalities with the kids. As I said, they've had only mild symptoms like maybe a fever, a cough, a sore throat. That's all. But in general, so far, all the kids who have tested positive have done really well.
So far, this is common for the people above 60. But why are we seeing the cases under the age of 60?
If you look at all the cases so far, most of these people have been elderly people. But there have been fatalities or people who are younger getting sick too, and that's been very rare. But if a young guy got really sick and died, they haven't had a good explanation for that particular guy getting really sick. Maybe he had too much of exposure. There is a lot of speculation. But majority of the people who've gotten really sick, who have died, as I said, only 2.3% of people who have tested positive died so far of all the cases, even in Italy, be it Italy or be it China. But if there was a young patient who died or who got really sick and had to be intubated, then he had a lot of exposure, or he didn't have the best of immunity. His immunity was maybe suppressed, but those are the only reasons. Otherwise, it's usually and has been only the elderly people who have not done well.
I just want to reiterate this question a little bit. Like, is that because of, under 60, is that because of the pre-existing conditions of the patient? That's
that's as I said, even if it is under 60, then you have to look at the pre-existing conditions for those people. Have these people had high blood pressure, diabetes, any lung diseases like chronic bronchitis, emphysema? These people have not done really well at all. People who have smoked, who have history of tobacco abuse, and who have had emphysema or chronic bronchitis, or for some reason, if their immunity is not that great, and even if the patients who are younger, if they've had any cancer, their immunity is already suppressed. So these people have not done well at all. Or any cardiovascular disease, if they've had a heart attack before, if they have any history of any heart disease, they have not done well. Diabetes, as I said, not done well. High blood pressure has not done well. Lung diseases, tobacco abuse, history of tobacco abuse, chronic bronchitis, asthma, emphysema, any cancer, they have not done well. Even though they were under 60, if they have had these conditions, they have not done well. So pre-existing conditions is very important.
So next question, any home remedies to keep the symptom low?
As I said, for fever, you would take Tylenol or paracetamol or acetaminophen. They're all the same with different names. It's the same compound. It's acetaminophen. In India, we call it paracetamol. Here, we call it Tylenol. If you have a cough, you can take a cough syrup. If you are weak, just make sure you keep yourself very well hydrated. But if you think your shortness of breath is getting worse, then you go to the ER.
We have a situation. We have a friend's family arriving from India. They are scared to take a public cab. Is it okay to go and pick them up? What is the safest approach?
So anybody who's coming from India, anybody who's had an international flight, I would suggest that they take a cab or a Uber to get home and assess themselves, monitor themselves for any symptoms. And if they think they're exposed or if they think they have any symptoms, isolate themselves and prevent the spread. So that's what I would suggest. Because they've been through a flight, they've been through airports. Nobody can guess or tell you exactly that I was not exposed. So I would suggest that that they take a Uber or a cab home, and based on their symptoms and everything, just take all the hygienic precautions once they get back, and then assess their symptoms.
If a grocery item is exposed to virus, and it was immediately stacked in fridge, will the virus die away in 3 hours time as well? What temperatures is the virus typically active?
The groceries, as I said, it's similar to the question about the mail, right? Unless and until somebody who's infected actually came into contact with that groceries, or if somebody sneezed or coughed onto those groceries, yes, there is the virus on that, and it can be viable for 3 hours. So after 3 hours, it is very unlikely that it's gonna spread. So to answer your question, it is highly unlikely that after 3 hours, it's gonna still spread. So that's what I would say.
So the temperature don't have any effect or the virus on surface, whether it is a normal room temperature or the refrigerator temperature, it just die in 3 hours, no matter what.
Yeah. I mean, it's only going to be viable for 3 hours, as far as the studies so far have suggested. So after 3 hours, it's very unlikely that you will have the spread from that virus, from that surface. Very unlikely.
How the major symptom of coronavirus is a dry cough. How about running nose? Is that one of the symptoms too, or can it be just a regular cold? And what's the chance that younger kids getting infected with COVID-19?
A running nose is very unlikely. I mean, so far nobody has said they've had a running nose with this COVID-19. As I said, fever, tiredness or generalized weakness, dry cough, lack of appetite, body aches, shortness of breath, and cough with phlegm in 27% of the cases. Running nose, it could be anything. It just could be common cold, could be any other viral infection. So the younger kids, they have a chance of getting infected. There is no difference between the chance of getting infected in younger versus older versus middle-aged. They are as much at risk as anybody is, but so far and thankfully they have not had too symptomatic. I mean, they have not been too symptomatic with the virus, even though they got infected. It's been very mild in the kids so far. As I said, maybe a fever for a day or two, a mild cough or a sore throat. That's it. So far, and touch wood. So far, the kids have done very well with this COVID-19. But the chance of getting infected is as good as anybody. Like a teenager, like a middle-aged, like older people, the same. If they come into contact with somebody who's infected, they might get infected. But as I said, the infection is mild in the kids.
I'm merging two questions because they're very similar. What do you suggest to university medical professional who cannot work from home? Unfortunately, they had to go on site and treat patients, exposed to patients. So what is your suggestion for them?
So that's me, right? So I have to go to work every day. So there is a chance of us getting exposed. So what I'm doing is, I have a pair of scrubs that I'm using. That I go to the hospital. I change everything there, and then when I'm on my way back, I leave everything, the clothes that I wore there and my apron, everything there in the hospital, and put my clothes back on. And then when I get home, before I can touch anything, touch anybody, I just go straight to the restroom, take a bath, and then come out, take a good bath, and then come out. That's the best we can do. I mean, there is. In spite of all this, there is no guarantee that you're not bringing back the infection, but just to be as safe as we can, that's all we can do, right?
One person got infected who stays at one-bedroom house sharing with a family. Then what precautions to be taken, especially at a bath and bathroom?
So if it is a single bedroom house, it gets kind of difficult because you're going to use the same bathroom and He can isolate himself as much as possible in the bedroom, and maybe the others can use the living room or the family room as much as possible until he's asymptomatic. There are no fevers, no shortness of breath, no cough. But coming to the bathroom, every time he uses the bathroom, I would suggest that they wipe everything really nicely with the Lysol wipes, and that should be very diligent. Everything that he has touched should be cleaned once he's done with it. Like if he's in the restroom, once he's out, he makes sure he cleans up everything, the sink, the commode, everything that he has come into touch with some Lysol wipes. And that's about it. And that's all I could suggest. If it is just a single bathroom, single bed.
Someone with the COVID-19 will have a steady high temperature more than 100 or fluctuates. What are the next steps in this case? Is the malaria hydroxychloroquine will work?
So yeah, so Trump in his press conference this afternoon spoke about hydroxychloroquine, which is an anti-malarial which has been here for a long time. So he's suggesting that he was suggesting that medication has worked well so far and it can be used. And almost immediately after his press conference, the FDA came up with their statements that this needs clinical trials. So it has done well in some areas in China where they've been using it, but it's not been a standardized treatment for COVID-19. And maybe it will be a standard of treatment for COVID-19 very soon. But as of this point in time, as of now, the FDA wants that only with a clinical trial. They haven't tested in any big population. They want clinical trials to confirm that this medication works really well for COVID-19. So China apparently has been using it in a few people in some population, and they have had some success. But as far as US is concerned, they want their own clinical trials before they confirm that yes, this is the medication and it might work. So somebody who's having very high fever, I would suggest they go to the ER, get admitted, and make sure they're stable before they can go back home.
Is it okay to go on walks within the community, not in parks or public places, but within the community?
Yes, you can. You should, as long as you're avoiding a lot of people or a group of people, yes, you can walk in a community, you can take a walk. Yes.
If you get infected, what medications hospital people provide? Because this is the new virus and no vaccination.
Yeah, if you get admitted to the hospital, they're not going to give you any new medications. They're only going to do symptomatic management. As I said, you have a fever, they treat that with Tylenol. You are too dehydrated, they give you IV fluids. You have shortness of breath, they put you on supplemental oxygen with a nasal cannula, or if you need more oxygen, they'll do more oxygen. But that's about it. But it is just, at this point in time, the hospitals are offering only symptomatic management, which means they treat the symptoms, the fever, the generalized weakness, the fatigue, the cough, the body aches, and the shortness of breath. That's all. No medication as of now.
Okay, in the same context, can we use the NyQuil, cold and flu medicine? You said don't use the medicine like Brufen.
Yeah, ibuprofen, anything that has, so some of these have combinations, right? Some of these cough syrups have combinations with ibuprofen, Motrin, most of them are ibuprofen, especially for the kids. There's a combination. So don't use anything which has a combination of ibuprofen or Motrin or Aleve. So use only things which have Tylenol. That's all. I would suggest that if you have a cough and if you to use a cough syrup, just buy something like Robitussin DM, which won't have any of these in combination. And then use Tylenol separately for fever. So I would do that. So don't use any combination cough syrups. Just use something like Robitussin DM or something like that.
People with asthma or COPD also gets a shortness of breath. Is there a way to distinguish it from the shortness of breath caused by COVID-19?
No, it's almost impossible. So if you think you have an increased shortness of breath, at this point in time, I would suggest you go get tested and not take a chance. Though you might think it's just an asthma exacerbation. But as I said, fever usually is happening in 99% of the people. So the shortness of breath in combination with the fever should prompt you to go to the ER. So that's what I would say. As I said, shortness of breath has been seen in only 31% of the population so far who've been positive. Fever has been in 99%. So before you get the shortness of breath through COVID-19, I think you would have fever too. So that combination of fever with shortness of breath should prompt you to go to the ER immediately.
So is a dry cough is also another parameter to track? Just I'm asking this question.
Yes, dry cough. Most of the people have only had dry cough. Only 27% of the people have had cough with phlegm. 59% of the people have had only dry cough. So
the dry cough is one indicator, and the high temperature with shortness of breath is another indicator.
Yes.
With confidence, can we use a regular tap water for cooking and shower?
Yes.
What specific precautions we need to take for pregnant women?
So no specific precautions. They're the same precautions that you take for somebody who's not pregnant. The same prevention measures that we spoke about earlier. Diligent hand washing, covering your cough or sneeze, avoid touching the face, avoiding crowds, avoiding close contacts, and cleaning and disinfecting objects and surfaces that are frequently touched. The same precautions. No special precautions. Obviously, if you have to be extra careful with all these when you're pregnant. That's all.
How about thyroid disease like hyperthyroidism? Are they considered less immune?
No. So far, they have not had anything to do with this COVID-19 severity so far, whether it was hypo or hyperthyroidism. So no, that's not coming. That's not considered less immune. No.
Okay, the next question. If you find the symptoms in kids, can we use Mucinex, children's multi-symptoms medicine?
Yes. Mucinex is fine. As long as you're not using Motrin, especially we use Motrin in kids and infants, right? So as long as you're not using Motrin, you're good.
Okay, the next question seems to be like answered already. Is a cough and fever continuous or intermittent for COVID-19?
They are, as I said, they peak on day 4 and day 5, and maybe you'll have them for a couple of days. That's all. But if it is persistent and continuous, then you should go to the ER. If it is continuous, you should go to the ER.
Okay, in the same context, next question. Can the sore throat alone, without fever, without cough, no body pains, be the symptom for COVID-19?
Yeah, there have been cases where people only had sore throat, and that is considered a mild symptom. So the 81% of the people who have had no symptoms and who have had very mild disease, so some of them have had only sore throat. That's it.
Okay, the next one. Do you recommend wearing a mask at home? If so, how often should I change the mask?
I don't recommend wearing a mask at home unless you think either you are exposed and you don't want to spread the infection, or when you think somebody at home might be infected. So we don't recommend wearing masks at home unless you are symptomatic, or unless you think you are exposed, no, we don't usually generally recommend wearing masks at all.
Okay, the next question is already answered about to make sure about the germs from medicine with so much of people touching at the store or online delivery.
Right. As I said, if you're getting anything that's from outside, you just make sure you. I mean, obviously the groceries you can't do that, but if any other stuff that you can clean up with any wipes or anything like that, any disinfectant, you can do that, and make sure they're disinfected thoroughly before you use them. So that's what I would say.
Jaipur hospital claims they have found cure for COVID-2 using antiviral medications used for malaria and HIV medications, which Trump is talking about in conjunction Ebola antiviral.
No, I think it is the same thing, the hydroxychloroquine that Trump spoke about. It is the same thing that the people in Jaipur are already speaking. I think in India, malaria is rampant, and we already use that drug a lot, the hydroxychloroquine. So it's the same medication that they're talking about. And in the US, they usually go with the clinical trials and make sure it works for that disease. In India, they might just start using it, because this medication has been in the market for so long, especially in India. We use it left and right for malaria, and it is not a dangerous medication. People don't die from it. So let's give it a try. Why not? So that's the mindset.
Okay, next question. What are the precautions we have to take in case one of the family member get COVID?
So, home isolation, obviously, you have to isolate yourself from the rest of the family. You have to make sure you wear a mask at home. Completely isolate yourself at home. Make sure you are in a room. It's very uncomfortable and it's not easy, but you have to do it to make sure you don't spread the infection to others in your family. So, I would suggest that, you are, even when you are, you avoid any close contacts as much as possible. Wear a mask. Be very, very diligent with hand washing, with cleaning any surface that you might have had come into contact with. And taking special precautions, especially when you're coughing or sneezing, to minimize the spread as much as possible.
The next question: how long it will take for getting a test results?
So right now, in most of these hospitals, they are sending the labs to the state lab. The state labs usually taking 3 or 4 days at this point in time. We don't have rapid testing available yet that they have in South Korea. We might get those very quickly, which would have results in 2 to 4 hours, but we don't have them yet. As of now, in North Carolina, we are sending those to the state lab, and it's taking 3 to 4 days for us to know the results at this point in time. So each state has its own timing right now. So we haven't gotten the rapid test kits yet. Hopefully soon we'll get those tests. Once we get them, they say you can get the result within 2 to 4 hours. But at this point in time, we are still doing 3 or 4 days.
Okay, the next question: does garlic, ginger, turmeric, etc. really works? Can we continue eating meat?
Yes, I mean, you can continue eating meat, but garlic, ginger, turmeric, these are all homemade remedies. They don't have any proven efficacy. So you can use them, but no studies have confirmed any efficacy with these foods.
Next one: my temperature is fluctuating through the day for several days now. Sometimes it is normal and sometimes it is over 100. Should I get myself tested for COVID-19?
Yes, you might as well get tested. Yes.
Okay, next one: can we use Dolo 650 for fever? Hope I'm pronouncing it right. Dolo 650 for fever.
Jolo 650, is that from India or? Where is that from?
They did not mention it here if it is from India or US. Just DOLO 650.
Dolo 650. Yeah, I think that's an Indian medication. Somebody must have gotten that from India. So Dolo 60, yeah, it is paracetamol. So yes, you can use that.
For fever, okay.
So it is just paracetamol. You can use that, yes.
Next one, should we use a multivitamin for kids to keep up immunity?
No, I mean, multivitamins have no efficacy or no proven efficacy as far as COVID-19 is concerned. So you can give them for general well-being, but when it comes to COVID-19, it won't make any difference.
Okay, the next one is say multivitamins for toddler kids to keep up the immunity.
No, I mean, they have not, I mean, for the general well-being, it might be good, but it won't make any difference with this disease.
Okay, the next question looks like it's not a question, it's a suggestion. My 2 cents, I want to tell people may have a sore throat now with the weather and we use the heaters with no humidifiers. Feel just by having a sore throat should not feel tense and go to ER. This is a mistake. Be at home and take precautions. If the symptoms worse, then should go to ER. When it is mild, it's better to avoid going to ER.
Yeah, and I completely agree with them. Yes. So these are very non-specific symptoms. As I said, a fever can be from multiple reasons. A cough can be from multiple reasons. So avoiding hospitals or any healthcare settings at this point in time is much better than going to them for something that's not warranted. But I would suggest that based on your work, based on your exposure, if you think you might have gotten exposed to somebody who had this COVID-19 and you have a strong suspicion, only then I would suggest you go for the testing. But basic symptoms, it's very hard to say that this could be COVID-19 or this is not COVID-19. So it depends on individual to individual. We can't generalize anything, but you just have to be a very individualized approach. If you have a combination of things like fever, shortness of breath, cough, sore throat, then it makes sense. But just with sore throat, yes, there have been cases only with mild symptoms like a sore throat. But as he suggested, it could be from anything else too. So I would not suggest that you panic and then go to the ER for a mild fever or a mild cough. Just think about what you've been exposed to, what were the chances of your exposure, and then make that decision.
Okay, the next one. There is a message about homeo medicine helping. Is that true?
No, not that I've seen so far or any studies have suggested so far, no.
Can we use a humidifier if we have a congestion? I missed that part.
Yes, you can.
Can we use paracetamol and aceclofenac brought from India if we feel any fever?
No, you can't. Diclofenac or aceclofenac it belongs to the same group as Motrin, Aleve, or ibuprofen. So you can't use that combination. You only can use Tylenol or acetaminophen or paracetamol. You can't use a combination of Tylenol and aceclofenac.
Does homeo medications like RHUS, I cannot pronounce this one, RHUS TOX 200 and Bryonia 200 prevent COVID-19? Does arsenicum album 30 help cure COVID-19 symptoms? Hope I pronounced it right.
No, as far as I know, there are no homeo medications that have been approved for COVID-19. So to answer your question, no.
And the next one, can we use elderberry syrup to kids to boost immunity?
No, as I said, with this, all these things will not make any impact. Yeah, so the budesonide is a steroid, and I would suggest that you not use it if you have a confirmation of COVID-19, because it decreases your immunity. You know, steroid, budesonide is a steroid. It's a nasal steroid. So you could have, usually we give to patients who have any allergies or shortness of breath or cough or bronchitis, sometimes to decrease the inflammation associated with these infections. But COVID-19, you can use it for your cough, but not for COVID-19.
Okay, the next one. Do you have any cases related to pregnancy or newborn? What are the risks to the baby if the pregnant woman is diagnosed with COVID-19?
Yeah, it can be transmitted from a pregnant woman to a newborn. But as I said, unfortunately, there are no measures that we can take. The pregnant women also have the same risk, and they have to be as diligent as anybody else. It's the same preventive measures that we take with somebody who's not pregnant. There is a chance that the newborn can have the infection through the mother. And depending on how the symptoms are, the pediatrician will have to manage those symptoms once the baby is born. So that's about it. But yes, to answer your question, yeah, there is a chance there is a chance for the infection to spread to the baby. Yes.
Okay, the next question. Can we use Alka-Seltzer multi-symptom medication? I will spell out if I did not pronounce it right. Alka-Seltzer.
Alka-Seltzer, yeah, I mean, Alka-Seltzer depends on, there are a lot of Alka-Seltzer, right? Alka-Seltzer plus, Alka-Seltzer cold. So depending on what you're using, it could be as long as you have not, you're not using a combination that has one of these, because most Alka-Seltzers have acetaminophen. The Alka-Seltzer Plus has acetaminophen in it, and then it has a cough suppressant, it has an expectorant, it has a nasal decongestant. So it's a combination of acetaminophen, dextromethorphan, guaifenesin, and phenylephrine. So each one has a function. So acetaminophen is a pain reliever and a fever reducer. Dextromethorphan is a cough suppressant. Guaifenesin is an expectorant that breaks down the mucus. And phenylephrine is a nasal decongestant. So that is Alka-Seltzer Plus. That is Alka-Seltzer Plus cough, mucus, and congestion. Then there is Alka-Seltzer Plus cough and mucus only, which only has guaifenesin and dextromethorphan. Then there is Alka-Seltzer Plus cold, which has aspirin in it, which is an NSAID. Surprisingly, aspirin has done okay, but the only medication that I would suggest you take is Alka-Seltzer Plus cough, mucus, and congestion. That combination. That will have everything, you know, fever reducer, cough suppressant, expectorant, and nasal decongestant. So remember that. Alka-Seltzer Plus severe cough, mucus, and congestion.
Okay. The next one. There are many epidemic disease occurs earlier and the people died, but this kind of quarantine not done before. Why this much of panic for COVID?
This is because, people, the number of cases have gone really beyond anyone's imagination here. So back in the late 2019, when it's first spread in Wuhan, it was just restricted to Wuhan. Then it rapidly spread, resulting in an epidemic throughout China. And then by Feb 2020, the World Health Organization designated the disease COVID-19, and then they called it a pandemic because they started seeing cases in Italy, Iran, South Korea, Japan, and then in the US, now in India. So India has surprisingly done very well for the dense population that we have per square kilometer. But when you look at Italy, they just reported 450 deaths yesterday. In one day, 450 people died. So this is kind of very severe, and because it spread so quickly in so many countries, people just have to take extraordinary measures to control it, and that's what is happening now. The earlier, the ones that we saw, SARS-2, they kind of were restricted to one province or one country to the most part. They didn't see this much of a panic or this much of this many deaths. So that's why the hurry. And as I said, by end of 2019, there were more than 80,000 cases of COVID-19 reported in China. And in China, the media is very restricted. It's all state managed. So if the outside figure is 80,000, I don't know the actual number. And as I said, Wuhan is a big city with almost 11 million people. And so by early 2019, if it was 80,000, it actually peaked between late January and early February of 2020. So we don't know the exact number, but I think the rapidity with which it spread to other countries, especially South Korea, Italy, Iran, and Japan, was what triggered the alarm.
Will there be another session in a few weeks to review the situation, helping us with the valuable sessions you provided? Okay, let me answer this one. Yeah, as a task, we are constantly monitoring the situation, and we postponed all our public gatherings or any events that we schedule in the interest of public health. So we are constantly monitoring if there is any situation that we need to provide information to our public. So we definitely arrange such sessions so that it will be helpful for everyone. So the next question is, airborne will give any immunization boosting?
No, nothing of that sort.
Okay. So this is a clarification from the previous question. We were mentioning about some medication. I mean, ALKA, SELTZER plus day and night gels. So earlier we were talking about a medication called Alka-Seltzer. So
right. Alka-Seltzer.
Do you suggest any breathing techniques during this time?
No, I wouldn't suggest any breathing techniques. No. They wouldn't make a difference.
Okay, the next one. What recommendations do you recommend for prenatal doctor appointments at the center? The center seems to be COVID-19 camping test camps as well.
So you mean pregnancy visits? Is that what you're asking?
It appears to be prenatal doctor appointments.
Yeah. So I think you're okay with going to prenatal visits. I think they would, any hospital or any healthcare center would isolate these testing centers from the regular outpatient visits or prenatal visits to be extra careful. So I think you can go ahead with your things, but once you are there, just be very cautious. Take all the precautions. Make sure you are not in close contact with anybody there. Try to wear a mask if you can. The healthcare professionals are already being very careful with the mask, with gloves and everything. So you also be extra careful. Once you get back home, just make sure you wash yourself well, wash your hands very well, and that's about it. You should be okay with all the prenatal visits.
Okay, the next one. Is headache one of the symptoms of COVID-2?
Headache, it's not been seen or noted in anyone so far, but it could be a contaminant. It could be one of the, body aches have been reported. in 35% of the people. Headaches per se, no, not really. But body aches have been reported in 35%.
Okay, next one. Is public or community laundry safe? Are there any special precautions to be taken while using the laundry?
Yeah, that's a difficult question because you never know who's using the public laundry, right? I mean, anybody could be using the public laundry of so many people. You never know who's infected, who's not infected. So
is it not the same
I
rule
would
applies?
avoid.
Sorry, is not
Yeah,
the same rule
same rule
applies the
applies.
3-hour rule?
Yes, but you never know what but you never know who touched it, when they touched it. Was there a 3-hour lag? You never know that, right? Once you're in any public area, whether be it a mall, be it a movie theater, be it a public laundry or anything of that sort, you never know who's been there, when was he there, was he infected, how symptomatic was he, all that stuff. So it's very hard to say, but I would suggest in general to avoid any public laundries at this point in time, if you can.
Okay.
If you have to, and if you can't avoid it, then I would suggest that you go in with a Lysol wipe, you clean up everything that you will come in touch with, and be extremely cautious. Once you get back home, make sure you wash yourself well again. And while you are there in the public laundry, make sure you go with the Lysol wipe and you sanitize the washer and dryer that you're using first with the Lysol wipes and then use it.
Are N95 masks really effective and can they be reused?
Yes, N95 masks are really effective in preventing airborne respiratory droplets. They're very effective, and yes, they can be reused. They are not. You don't have to throw them away after a single use. They can be reused. For how long they can be reused is depending on the condition of the mask. As long as they are working, as long as they're in a good shape, they are covering the nose completely, you can use them.
So what if we don't find any masks in the future, and are there any alternatives to protect ourselves instead of this mask?
No, not really. I mean, I would suggest you wearing a mask only when you are in a public place to just, avoid any. It's not necessary. It's not a mandated. It's not mandatory that you wear a mask, but just to be on the safe side, it's for your own protection to be extra cautious. So if you can, you wear a mask. If you don't have a mask, then it should be okay. But if you're really scared, you can get innovative, with either a scarf or something like that,
Yeah. Okay, the last question from the chat window. Can we use Dayquil, NyQuil, cold and flu relief medicine?
Dayquil and NyQuil. Dayquil and NyQuil, they should be okay. As long as, as I said, these are usually they have the same combination as Alka-Seltzer. It's a combination of paracetamol, cough suppressant, mucolytic, and a nasal decongestant. So you should be okay as long as it is acetaminophen or Tylenol. Just make sure you don't see the name Aleve or Motrin. Aspirin is also in the same class as Aleve or Motrin, but surprisingly, people who have taken that have done okay. It's not as bad as Aleve or Motrin.
Okay. Very last question from this chart. TB infection 20 years back, can it be a pre-existing condition now?
TB, 20 years back, I don't think so. It has been 20 years since somebody has had TB. I don't think it can be pre-existing condition because most of us Indians, we test positive for TB when we take a TB test. That doesn't mean we are immunocompressed, immunosuppressed. The very fact that we don't have any active manifestations of TB
means that your immunity is good. So I don't think, I don't consider that as an immunosuppressed condition, no.
So I think that was last question from this chart. And before I move on to the voice questions, like I want to say, like, for the COVID-19, there is no medicine from this understanding, but at least all this session information, like, is a medicine for all of our psychological stress that we are taking for so long, for a few weeks. So hopefully this is a good information for everyone out here, and then probably they will share this information with their friends and families, and they'll be safe.
No, we can have a session again in a quick time, maybe 1 or 2 weeks to go over everything once again if you guys want it, and we'll go more over the developments at that point in time. It is almost 11:10 here. I have to get up at 5 o'clock in the morning tomorrow. So if it's okay with you guys, we'll call it a day.
Yeah, definitely. It's really good information. We really appreciate and thanks for all your time and information that you provided, Dr. Kalyan.
No problem. My pleasure.
Yeah. So on behalf of TASC and our South California Telugu families, and there are a lot of other families too, on behalf of everyone, we want to thank you. And definitely we'll coordinate another session, like going forward, like if there is any information needed for the public.
Sure.
Thanks everyone for joining this call, and hopefully this information will be very useful for every one of you. And yeah, on behalf of TASC, I want to thank all audience and our today's speaker, Dr. Kalyan. And we'll end this session here. And again, we'll have more sessions in the future. So until then, stay safe, stay home, and be more informative and cautious.